Hi, it's Dr. Sandy Cremers, board certified surgeon. If you have dry eyes, dry mouth, and joint aches, you may need an autoimmune disease workup. And so if you've been kind of trying to figure out what you should do, talk to your doctor. But in general, I'll order a general marker called the ANA or anti-nuclear antibody. If it is positive, it tells you you're on the spectrum of autoimmune disease. If it's negative, we'll do an exam, look at your hands, maybe talk to your medical doctor and recommend a rheumatoid factor, SSA, SSB, general markers for Sjögren syndrome, sometimes an anti-CCP. But in some cases, if everything is still negative, we will continue to ask about things like chronic back pain, and we'll check for an HLA-B27. If you know you have back pain or you've had a history of uveitis, we'll generally check an HLA-B27. And the key thing is to see where you are on the spectrum of inflammation. We're looking for an autoimmune disease. So if you have a loss of oil glands on the meibography, significant dry eye, or even minimal dry eye, but there's very few oil glands, we'll sometimes even do a full SJO test, which is about 13 markers for autoimmune disease in the Sjögren spectrum. Things like salivary protein 1, carbonic anhydrase, a whole bunch of those, and parotid specific proteins. We're looking at the other salivary and parotid glands to see if they're also being affected by inflammation. And it will give us an idea if we need to do further studies. We'll also look at complement 3, complement 4 sometimes, anti-double-stranded DNA for lupus, anti-Smith for lupus, in addition to a general blood work like a CBC and metabolic panel. And then, of course, the thyroid panel, which includes the TSH, free T4, free T3, reverse T3, thyroid globulin antibodies, the TPO antibodies, and the TSI, thyroid stimulating immunoglobulin for Graves' disease. If you have chronic pain, you might want to get a full evaluation by your doctor for vitamin D levels, vitamin B12, B1, B6, folate, iron, ferritin, homocysteine, and the different immunoglobulin markers like IgA, IgM, IG4, IgG4, ANCA even. I've had a case that I reported in ophthalmology in a case of Wegener's with ANCA level elevated, ACE for sarcoidosis, looking at celiac risk. We'll even do sometimes other tests like a syphilis test, TB test, a herpes simplex test. We're looking for anything like a virus that might be triggering your corneal nerves to fire, which is very rare, but we don't generally pick these up unless you go to a specialist in chronic eye pain. Additionally, they'll do a hemoglobin A1C, uric acid level, cortisol, DHEA, SPEP, and all these different types of tests to just make sure everything in your body is working well. Because if you have chronic pain, we want